One of safety. If something was to happen to you while we were talking, I can't pick up the phone and call 911 because that 911 number cannot get services to you where you are. There are different services out there that would give me the right number to call, but as a provider, that would cost me $12,000 a year. Before I can even see you, there has to be someone looking to see what that number is and embedding it in the chart. And we find that typically takes a half hour of somebody's time. And so a lot of time, the provider has to put in that time personally because they don't have support. Or if they have support, it's going to be taking their office staff about a half hour to get that right number in there. Now, once they find it, they put it on a homemade spreadsheet and everyone has these, paper copies of like ridiculous. There are differing standards by payer of what they will cover. So right now, CMS says you need 16 days of data, you need these 2 points, and then you need the average over time. EMRs aren't built to do that, right? So you have to go with a third party to do that. That third party is not fully integrated with the EMR or isn't integrated with a common aggregator like Apple Health or Google Health. And so technology is needed to be vendor agnostic to get that stuff into the patient's phone, which then is integrated into the medical record, because it is more time for the clinician and for the support staff to actually, how much time did we spend? Was it 16 days within 30 days? Is anyone else billing for something because you can't have two, even if it's two clinical conditions? Are they on remote therapy management as well? What are the things here? What codes have to drop before and after, right? That is something where technology can help, but health system can't afford multiple vendors doing that and then integrating those costs. So technology needs to step in between the vendor and the aggregator, which is your phone in most cases, or your watch, to be able to provide that data seamlessly to the provider.
I think integration is probably our biggest technical challenge. We are a one EHR system, but we don't use Epic or Cerner, so we use a smaller EHR system, and we find that it's hard to get a lot of integration because we don't kind of use one of the big two. Getting our telehealth platform integrated with our EHR and our other systems, and then getting like our scheduling, our other prescriptions, and all of our other systems to kind of talk to each other has been a challenge. We're currently right now working to find an enterprise telehealth system that integrates with our EHR, because that with telehealth specifically has been one of our bigger challenges, is kind of finding that enterprise platform that can serve patients in all of our different care settings.
Well, we have a VICU unit, which is a virtual intensive care unit, where we have 24 nurses that are working 24/7 to assist with our bedside nurses in providing care. One of the issues that we have been trying to solve, and we can't seem to find a solution, is known as the second signature. And this is a second sign-off whenever there's blood administration or the administration of a high dosage or high-risk medication. If the bedside nurse is administering a high-risk medication, instead of having to contact another physical nurse, we have the virtual ICU nurses that are available if we can somehow get them access to the EMR to be able to share the screens, the information, allow them to witness and be able to apply their signature in the EMR in an easy, streamlined process will be an extreme benefit for our organization. Seems like it's simple, but with our current EMR system, we cannot seem to find an easy way to solution.